Hey, how's it going? My name is Colin, Dr. A, and I'm going to address a subject that's come up many times, over the past couple of weeks for me, especially when people come in for surgery or even before surgery. It's like, hey, can I smoke weed? Can I use marijuana? Can I use medical marijuana for my surgery to help my pain? And the answer is yes and no. So before you end up over here on our table over here, you want to make sure that you're going to have the best anesthesia you can possibly get, that you go to sleep as smooth as you can, and that the anesthesia won't mess with you in any type of way. And then when you wake up, that your pain will be as controlled as it possibly can be. The only thing we use in marijuana is that it can basically increase your requirements for anesthesia and also increase your requirements for pain medications too. So for us who do a lot of times deal with people who don't use marijuana and stuff too, we may actually end up underdosing you somewhat as far as your pain medications, or maybe underdosing you as far as the actual anesthesia. And we have a bunch of other monitors way back there in the background that helps us sort of know how asleep you are. But again, those things can become more challenging. So ideally, you want to stop using marijuana. It's usually like 4 days, 4 to 7 days. It's usually a week before you come in for an operation. So basically get that out of your system. So when you come in, especially if you come off the street, you broke your leg, and you're going to have something where you're really going to need all the pain medication to actually work the way you want it to work, then you want to just make sure your system is as clean as it possibly can be. The other thing is that marijuana has effects, in and of itself that can interfere with the anesthesia, because sometimes undergoing anesthesia over there can lead to you wanting to vomit more, can lead to you feeling a little more delirious and not knowing where you're at. And again, if you add the effects that marijuana can give you as well too, then those effects can be even more. So you can feel more paranoid, you can feel more delirious, you can end up vomiting a lot more than you'd expect too. So again, people who use marijuana chronically, it's been proven that in some people at least, or a good number of people, that they get pretty good pain relief with using it. And a lot of times you can replace opioids and stuff beforehand. But weirdly enough, like around what we call the perioperative period, the time when you're going to have surgery and whatnot, we recommend that you stop taking it. So stop taking it a week beforehand. And as far as when to resume it, I would say at least when you're out of the hospital and out of the time when you're going to need all these acute pain medications to really, really work. So my name is Colin, Dr. A. And if you have any questions, feel free to hit me up on Instagram or send me an email. Peace.